Hi, this is Jessica DaMassa from the Healthcare blog, and I'm here with Bruce Greenstein. He is the CTO for HHS. Bruce, welcome to the show.
Thanks for having me.
Well, we are on the eve of Health DataPalooza. It is coming up on April 26th and 27th, and so it's never too late to register. So we're going to talk to you from HHS and just find out a little bit more about Health DataPalooza. But before we get into that, we want to talk to you a little bit about what's going on. So what is going on? To give me a little bit of an update on the open data movement that's been happening for the last 5 years. What's been happening? Where are we at? What's going on?
Yeah, so the open data movement is now reaching a fevered pitch. For the last, as you said, about 5 years, people from the department and all across the country have really been excited and evangelizing the benefits and value of open data. And no one disagrees with that. We are now deep into a project, a major initiative across the entire department of HHS, shared across OMB as well and other agencies, about actually making that a reality. So now we get into the less glamorous and really difficult aspects. How do you liberate data? It becomes an exercise in legal frameworks, data use agreements, contracts, privacy and security issues, and we're addressing those right now. This is something that could take a full generation until it's finished, but we're looking for quick wins. We're looking to reconcile legal issues that will allow us to share more data more freely and put it to use to improve the quality of our programs, help more people, and make the programs less expensive to run.
So our audience has a lot of folks who are on the front line in health IT and health technology. What can they do to help and maybe speed this up just a little so it's not a generational project?
Yeah, well, so the legal issues, we're running them as hard as we can. So that's something that I'll just have people continue to be enthusiastic and support. But here's a couple things that I would ask your viewers to go and do. Okay. We run an important property called healthdata.gov. That's our principal showcase for valuable data sets and assets that we have and that we broker on behalf of some of our partners, let's say state governments. We're in a process of reviewing that, and we'll turn out healthdata.gov 2.0 site later this year.
Okay.
We want to make sure that we know what people want, what people don't use, what makes it hard to use. We want to improve it and really make this a website of data for the people instead of just for government bureaucrats. So I'd ask everyone, go out there, hit the site hard, try to answer important research questions or do some market analysis or figure out better policy prescriptions. And when you have problems or when it works great, let us know. And you can do that through the website. But we're using all of the feedback that we're getting right now to go into how we're revamping that website in a 2.0 model.
I also want to know a little bit about what the HHS is doing with its own data. I understand you've been doing some new things to help guide policy. So talk to me a little bit more about that.
Yeah, I think that it's popular to say data-driven decisions or data-driven anything for that matter, but it's really hard to actually use the data beyond its original purpose. So just as a level set, take CDC, for example. One of the world's greatest data-producing departments or agencies, and they do a superb job of using that for its primary purpose, which is to report on something. Let's say it's immunizations. What we're not very good at from a government and HHS specifically, it's using that data to do something else with, the secondary purposes, maybe to match it up with claims data to show how good health plans or different doctors or health systems are at distributing immunizations at the right time. So we talk about doing a better job. That's an example. Here's, I think, the most important use case in current times. And that is assuring that we're using our data to make the best allocation and resource decisions with opioid dollars that are coming in from Congress.
Right.
We're in the process, and you may recall that in December, we ran the National Opioid Summit and the Opioid Codeathon here. We brought together more than 70 data sets. We had developers and computer scientists from around the world, more than 50 teams, and we focused on using HHS data and state data to come up with novel solutions and better ways to look at delivering services to help people that were dealing with the disease of addiction. And we made a lot of progress, but we also recognized that those data sets are at best slightly limited use, and for the most part were public use files. We weren't able to quickly move to get more data beyond what's on our websites, and they're very, very difficult to connect. When you don't have an individual identifier or a zip code or even a county, then they become something that's too broad to make really precise policy prescriptions, and that's what we're aiming for. So we're taking all of those experiences to heart, and we're working on methodologies to be able to match data, to be able to lower the barriers in terms of additional data to be put out, public use files to go beyond that. And we're using the opioid epidemic as one of our central themes to harmonize data so we could come up with better data sets that we can make better policy.
You know, adding into that data, you know, immediately as you're talking to us, I'm thinking about the news right now about Facebook talking to different hospitals about getting their data and things like that. And it brings to mind the fact that a lot of these consumer tech companies are entering into this space. You've got Apple, you've got Amazon, and they're making a harder push than ever. And I know in your background, you worked at Microsoft. So I'm curious, yeah, and so I'm curious, you know, how is, now that you're on the other side of things, how is that going to shape how you end up working from the HHS perspective, how you end up working with these consumer tech companies or these consumer companies coming in wanting to work with HHS data?
Yeah, well, the flip is significant. So before I worried about addressing quota and my comp plan, and now I worry about civil liberties, privacy, and security.
Well, you went from a hoodie to a suit.
Exactly. But the important aspect is, how do we take the data that is available, and it is beyond private and secure, and to put it to work to give an advantage to, say, health systems to provide better, more specific care? How can we do it so that when it comes down to health insurers, they can use their data and other sources of data better to be able to get the right kind of preventive care or wraparound care for chronic conditions or people with very expensive conditions, so that people can live happier and healthier lives, and they could also spend less on unnecessary care. This is an area that we're wading into maybe for the first time with non-traditional healthcare data suppliers and users. Mm-hmm. It's very, very interesting. Each element has a way that I can think of to offer either a unique or an unusual value proposition to us. So, and when I say us, I mean the American people. For example, healthcare in general struggles with supply chain issues, especially for people providing or getting the provision of care in their own homes. Amazon, obviously, is a world expert in supply chain management, getting things of a variety of sort to people's homes in a timely way. Facebook is superb at creating social networks or groups around certain themes, whether it is when you graduated from high school and your class stays together, or maybe it becomes then around a disease or a condition that people are sharing information that's either not well known or support is necessary. If we do this right, we can use some of our private sector partners to supply the kind of information necessary and their value proposition to what they do, again, supply chain, social network, to be able to help address some of our most important problems far more efficiently than we would be able to if we decided to start from scratch.
So it sounds like you're a little bit more open-minded, maybe, because of having sat on the other side of that table.
So two things. I'm beyond open-minded. I'm already trying to sink my teeth into how we partner up with the best in class that have the most private and secure, whether it's servers and or policies, or both preferably, to be able to address problems that have been just beyond our grasp for so long. And we know whether it's around genomics and the computation and storage of the data, whether it's, again, thinking about providing more services in rural areas where getting supplies and attention to people have been difficult, and we can use a supply chain like Amazon to be able to deliver goods and services. And it could be, Facebook, could be LinkedIn, it could be a variety of ways that we think about surrounding people and providers with the information and resources that they need to help people. And maybe it's around people that are dealing with addiction and need support. to combat the opioid epidemic, or maybe it's around providing services in rural areas when the ability to be able to communicate and do some of that work that are collegial in a teleway rather than in traditional ways of face-to-face. We know the benefits of telehealth and telemedicine, but now when we think about how do we support the caregivers and the providers, there are other ways to do that as well.
So anybody who has any of these ideas, either about integrating these different technologies from the consumer standpoint, or even some of that feedback that you're looking for on the open data movement, they have an opportunity to run into you a couple times here coming up. So talk to me about Health DataPalooza at the end of April here. It's the 26th and 27th. What can people expect who want to go?
Yes, it's just less than 3 weeks now. So book your plane tickets and
never too late to register.
yeah, get out here. There's a couple things that make Health DataPalooza a must do on people's calendars. One is the content that will be delivered is curated by a group of some of the nation's most interested and interesting people in this area. And so I know the work that's been going on to bring data experts and owners, providers, health plans, some of the most interesting companies that are both startup as well as very big names. And I'll tell you to go look at the website to list off. It's also HHS and other government agencies that deal in health and healthcare. It's our premier conference where government people come to talk to data lovers and data users. And we take this very seriously. It's a time to interact, to create. That's
so important. I want to stop there because that is really important. The fact that this is like the government's big conference.
Yes.
It's like that. It is a major player in how we deliver healthcare, how we design systems for healthcare. So I think that's a point that needs to be understood about this conference. I've been several times, and it's like it really is a different perspective.
Yeah, if you think about, we'll have the Secretary of HHS, the head of CMS, FDA, ONC, and then myself, which is the added bonus.
So many acronyms. How much fun is that?
We'll all be there on the main stage. And then there's all the time in between getting coffee and going into smaller breakout groups where you could have meaningful conversations. You could understand what's going on across the country. You could do your networking.
We have to ask for Matthew Holt. Where's the party going to be?
I would tell him, go follow Matthew on
follow Matthew on Twitter and he'll publish his
find out where the parties are. I know I'll be looking.
Fantastic. So if people want to register, they should just go to the Health DataPalooza website. Is that the best way to do it?
That's the best way, yes.
All right, fantastic. And then I'll also plug for you there. I know you're going to be speaking at the health conference, the HLTH conference coming up in May as well. Are you looking forward to that? That's a brand new conference.
Brand new, well-resourced, well-researched, and probably the largest number of CEOs of important companies from across the country and the world that I've ever seen brought together. I couldn't be more excited to go and learn from the other CEOs and also to present to the audience what we're doing here at HHS.
Cool. Well, we'll see you at Health DataPalooza, and then we'll see you again at Health. Bruce, thank you so much for joining us and for giving us a little bit of insight on what's happening at HHS and the Open Data Moon. It's a pleasure to speak with you.
Jessica, thank you for your time, and thanks for the time to present the issues.
Anytime. This is Jessica DaMassa from the Healthcare Blog with Bruce Greenstein, the CTO of HHS. Talk to you guys soon. Thanks.
Bye.